The objective of this multidisciplinary project is to generate a novel therapy for pulmonary fibrosis using aerosolized peptide nanoparticles loaded with the third-generation antisense oligonucleotides, targeting the LIMSH1 protein, which is a component of stress fibers expressed by pulmonary myofibroblasts. The project is divided into 3 tasks. In task 1, we selected ASO sequences based on human and murine LIMSH1 protein knockdown and low toxicity, and generated nanoparticles with a size of 100 nanometers. Work on aerosolization of the nanoparticles is in progress. In task 2, we developed technologies to improve aerosol delivery and dose control in mice. In task 3, after the dose-finding experiments in healthy mice, we performed the first experiments in the bleomycin lung fibrosis model. Other experiments in the pathological model are ongoing. Thank you for your attention.
Hi everybody, my name is Fernando Torres Andón and I will walk you through part of our work on the 2 INTRATARGET project. The work consists on developing polymeric nanocapsules loaded with resikimod and poly-IC to reduce tumor-associated macrophages into M1-like anti-tumor macrophages. We evaluated in vitro the biocompatibility of these nanocapsules and their efficacy to improve the ability of macrophages to kill cancer cells and secrete cytokines to recruit T cells to the tumor site. Upon intratumoral administration, these nanocapsules reduced tumor growth in a subcutaneous model of lung adenocarcinoma and prevent metastasis to the lungs in a fibrosarcoma model. With this protocol, we observe similar results for the free drugs in vivo. Therefore, now we are working on the intravenous evaluation of our formulations with the expectations to achieve higher antitumoral efficacy with lower toxicity. Thanks for your attention.
The aim of the RESOLVE project is to generate super-suppressor monocytes after flip mRNA transfection as promising therapeutic strategy to restore a tolerogenic environment in graft-versus-host disease and multiple sclerosis. To achieve this goal, we took advantage of new nanomedicines able to specifically target in vitro and in vivo monocytes. The engineered monocytes show both the expression of putative M disease-associated markers and overall functional properties on limiting T-cell proliferation. The infusion of in vitro transfected C-FLAR human monocytes resulted in a therapeutic effect in GVHD undergoing mice. Additionally, in the EAE model, the infusion of transgenic C-FLAR expressing monocytes show a constant reduced severity compared to wild-type treated mice. Overall, C-FLIP-enforced expression offers promising opportunities in the treatment of pathologies originating from immune system dysfunction.
Hi everyone and welcome. In my poster, I would like to present my work on developing targeted nanoparticles for delivering highly potent drugs. Potent drugs such as MMAE is super toxic and thus they have to be used in combination with antibodies. However, there is limitation in number of payloads and conjugation methods. In my work, we use a modular approach in which we functionalize its ELP modules with a targeted nanoparticles by genetic engineering and with MMAE by chemistry. Later on, we co-assemble the ELP modules into a targeted ELP nanoparticle that loads MMAE in a controlled manner. Our targeted nanoparticles showed an IC50 around 2.5 nanomolar, indicating that they also work as effective as the three drugs. We are currently conducting in vivo evaluation and we expect that these targeted nanoparticles will also perform well.
First, a nanocomposite using chitin nanofibrils and biodegradable copolymer PEOT-PBT was created. Chitin nanofibrils were used for their anti-inflammatory activity, and the composite was obtained via extrusion in addition of polyethylene glycol as a plasticizer. The gradual growth of collagen enveloping the complete eardrum scaffolds, especially on top of the FDM filaments, could be shown. Furthermore, the deposited collagen fibrils were noted to be following the alignment of their corresponding cells. All scaffolds demonstrated a vibration behavior in the range of the native human eardrum. In wet conditions, experimental factors like pretension had a greater influence as compared to the thin and flexible FDM filaments. Different nanofibers will be functionalized with biodegradable small nanoparticles containing antibiotics to ensure local and controlled delivery after surgery. Two approaches will be used: molecular imprinting of polymers and the co-precipitation method. The purpose is to synthesize smart nanoparticles with drug release profiles to act in the acute post-operatory phase within about 2 to 3 weeks. The results shown lead to the conclusion that all scaffold designs are suitable for a biological and functional tympanic membrane graft.
The aim of the MAGBBRIS project is to improve local brain targeting and promote tissue repair after ischemic stroke. To do so, we encapsulated stroke patient endothelial progenitor cell-derived secretome, which promote angiogenesis and blood-brain barrier tightness in vitro, in multimodal PLJ nanocapsules. These nanocarriers have been functionalized with SPEEDY for magnetic targeting by an improved magnet device and tracking by magnetic resonance imaging, as well as with fluorescent dyes for tracking by optical imaging. Moving from in vitro experiments to a first preclinical to clinical translation step, we have proved the feasibility and safety of acute intra-arterial nanocapsule administration after cerebral ischemia. This new therapeutic approach could be useful to further deliver therapeutic secretome to promote neurorepair, which could be considered in this new era of endovascular interventions in the clinical acute stroke management.
The present work is focused on the generation of improved human skin keratinocyte cell cultures using lipid nanocarriers. In general, generation of bioartificial human substitutes, such as the artificial skin, is strictly dependent on the availability of human skin keratinocyte cell cultures. However, these cells are very difficult to grow in culture and grow very slowly. Therefore, we have used novel lipid nanocarriers loaded with epithelial growth factors as a way to improve cell proliferation. Results show that the use of these nanocarrier particles is able to generate more efficiently and more rapidly in cell cultures of human skin keratinocytes for use in tissue engineering of the human skin for clinical purposes.
The regeneration of the subchondral bone is a major challenge in patients affected by osteochondral lesions treated with conventional scaffolds. NANO-SCORES aims at improving an osteochondral scaffold already used in the clinical practice through two different nanostrategies. The first one, the chemical strategy, involves the addition of calcium phosphate granules to the scaffold with or without strontium ions. The second one, the biological strategy, provides the addition of specific growth factors to attract and stimulate cells from the surrounding tissues, thus facilitating the production of new bone. These new scaffold prototypes have been chemically characterized and they have been implanted in a mouse model of osteochondral lesions, and preliminary results already showed initial bone tissue formation. The osteogenic potential is tested in a goat osteochondral defect model, which is currently ongoing.
This poster presents the result obtained after using liposome decorated with hyaluronic acid as drug delivery system, specifically targeting fibroblasts, which cause the fibrotic lesion in two main fibrotic disorders: interstitial lung fibrosis associated to collagen tissue disease and bronchiolitis obliterans syndrome after lung transplantation. We demonstrated that hyaluronic acid decoration of liposome might be useful in the targeted treatment of lung fibrotic disorders, and that a higher molecular weight of hyaluronic acid increases the targeting efficiency. Moreover, we assessed that liposome decorated with hyaluronic acid can be a feasible nanotool to vehicle everolimus, an immunosuppressant used in clinic but with important side effects. And finally, liposome can be considered as new therapeutic option for both NCTD-ELD affected patients for which there is still no therapy able to reverse the disease.
Hello, I'm a PhD student working on the GLIOGEL project. My part of the project consists in the development of a dual drug delivery system for glioblastoma treatment. Glioblastoma recurrences are in fact very common, and one of the main reasons seems to be glioma stem cells. So we started from the Laurel gemcitabine lipid nanocapsule hydrogel as a scaffold, and we encapsulated salinomycin because it interacts synergically with GemC12. Both drugs were released from the hydrogel over a period of 30 days, and the formulation was able to inhibit the growth of glioblastoma spheroids. The next step will be to prove the efficacy of the hydrogel in vivo. After tumor injection, a resection will be performed, and the gel will be placed in the cavity, potentially leading to the prolonged animal survival and the elimination of both glioblastoma cells and glioma stem cells.
The present poster describes the procedure we follow to evaluate polyamidoamines as double-stranded RNA nanocarriers, aiming at blocking the Plasmodium parasite invasion of Anopheles mosquito midgut. Epithelial serum protease and cactus were the two mosquito genes selected to be targeted by the RNA interference approach, as their key role in parasite development has been shown. Even though it was observed that PAAs are able to bind the double-stranded RNA constructs efficiently at a specific weight ratio, administration of PAA double-stranded RNA polyplexes to mosquitoes via sugar feeding did not cause any significant silencing of the target genes in the tissue of interest. The low quantity of double-stranded RNA that can be incorporated into PAA nanoparticles could be a possible explanation. Our focus now is by using fluorescent label components to examine whether double-stranded RNA PAA polyplexes are able to reach the midgut and release the double-stranded RNA there.
The aim of Project AMI is the development of a field effect transistor biosensor for the point-of-care detection of anti-drug antibodies. Each AMI partner contributed to this project thanks to its strong expertise. DropSense designed and fabricated the device gold pattern by laser ablation on PET flexible substrate. The University of Strasbourg patterned the device with reduced graphene oxide as the active material and also functionalized it with Lupuzor, one of the drugs object of the study provided by Mupharma. LATAT designed and printed a 3D microfluidics platform to integrate the device for point-of-care approach. The University of Modena and Reggio Emilia optimized the functionalization of the biosensing surface, performed the measurements and the analysis of the results. We demonstrate that the final prototype is able to specifically detect anti-infliximab antibodies with a low limit of detection, also in presence of interfering agents.
Hi, this is Dr. Anup from the University of Israel. Today I will talk in brief on hollow core photonic crystal fiber assisted Raman spectroscopy for the early detection of Alzheimer's disease biomarkers. Since molecular biomarkers are the main indicators of a particular health and disease state, therefore their detection is crucial for diagnosis, monitoring, and treatment of particular disease. Amyloid beta and tau proteins are recognized as a main biomarkers for AD, and it has been observed that these biomarkers begin 15-20 years before the first symptoms appears in the patient. Here we have chosen a hollow core photonic crystal fiber bare Raman setup to perform a PRS and a CRS measurement of a beta 40 Raman signals. We have observed 15 times more enhancement of Raman signal for a beta 40 with HCPC compared to the conventional Raman signal, while 200 times more Raman intensity was observed with silver nanoparticle decorated fiber generating a CR effect. Therefore, the use of HCPC based platform can provide sharp and intense Raman signal and will be a promising tool in the development of a sensitive detection of early diagnosis of AD disease biomarkers. Thank you.